Hello everyone, greetings from London. Today I'm going to discuss about a paper we presented here, and it is about our work on tuberculosis in infertility. There has been a lot of debate on this topic, especially whether and when and for how long we should be giving antitubercular treatment. There are multiple tests for tuberculosis. There can be microscopic examination, culture, CB-NAT. Then there is PCR. Along with this, there are initial tests of Montaux and quantiferon gold. With this huge mammoth of tests, and each with its separate sensitivity and specificity, it is confusing both for the patient and the doctor to decide whether antitubercular treatment in pelvic infertility should be given or not. We have come to the rescue by a very good paper by many scientists, including Dr. J.B. Sharma from All India Institute, and what we follow is the Composite Reference Screening, the CRS, which has also been suggested by the WHO. Now, what is the CRS assessment? First is there has to be a history. Now, what is a history? History means either you have repeated failed IVF cycles or sometimes even repeated miscarriages without any underlying or detectable cause. Examination, it could be a fixed uterus. It could be examination where we are seeing multiple pelvic masses. It could also be a finding of ultrasound where the endometrium is repeatedly coming thin, and by thin we mean anywhere less than 7 millimeters and definitely less than 6 millimeters. Along with all this, there has to be either an adnexal mass, means a collection in the pelvis, which is detectable either by ultrasound or laparoscopic findings of tuberculosis, which are sometimes very specific in the form of a python-shaped tube. These are again signs given by scientists from India and abroad, especially Dr. J.B. Sharma. And it's very good to read papers of this kind. There could be adhesions in the abdomen. When we do a hysteroscopy, it could be a scarred uterus. So all these history examination findings plus laparoscopic adnexal mass hysteroscopy, if you combine, then we can start antitubercular treatment. And this treatment is usually given for 6 months. It's 2 months of intensive treatment of rifampicin, isoniazid, pyrazinamide and ethambutol, followed by 4 months of 3-drug treatment. Our paper that we presented, we saw about more than 50 patients with similar criteria fitting in with history examination, laparoscopic findings, and then we gave antitubercular treatment to them. And we found a significant increase in IVF pregnancy rates, almost touching to 55% to 60% per embryo transfer. So it's an important finding. We've shared it in the World Forum, and we would like more and more doctors, especially from countries where tuberculosis is common, to corroborate these findings and see whether this treatment really helps our patients or not. Thank you so much.